time goes. James Evans.
Presiding officer, we've had over 6,500 responses to the consultation. That's a huge number for such a technical service like dentistry, and it shows how deeply in that service care. Patients want continuity and dentists want prevention properly valued, and everyone wants a contract that works in practice, not just on paper. Yet what is being proposed stretches recall intervals to 24 months and leaves big gaps in clarity about funding, access and accountability. Continuity of care is my first concern. The government originally wanted to take green patients off practice lists and push them into a centralised system. That plan has been dropped, and rightly so, because that's what people were telling us right the way across Wales. But what is the guarantee in the contract that people will still be able to see the same dentists, and what safeguards will there be for older patients, especially in rural communities, and those without transport and digital barriers who could otherwise slip through the cracks in this policy? Then there is the issue of valuing complexity. The BDA has been clear: restorative work, dentures and endodontics, these remain undervalued, and under the new model, if the government is confident that this will work, will you not now publish the full schedule of fees so we can see exactly how dentists will be paid fairly for simple, moderate and complex care? Because if complexity is not rewarded, more dentists will walk away from NHS contracts and patients will pay the price with their oral health. Prevention is supposed to be at the heart of this reform, but how will the Cabinet Secretary measure it? Will we simply count the numbers of appointments, or will ministers commit to tracking outcomes like the rates of decay, the number of extractions and emergency attendances, and crucially, early detection for oral cancers? And will the Senate receive regular reports from the Cabinet Secretary so that we can judge if prevention is actually working, or is this just another element of where we say we're going to do prevention, but it never actually appears at the end? Access is another worry. We were told there'll be a new digital portal to manage entry into NHS Dentistry. But I'd like to know, what about those thousands of people across Wales who are digitally excluded? What about the older people who don't use online services or community where connectivity is poor? The Older People's Commissioner has already raised concerns here. So will the Cabinet Secretary guarantee that non-digital route into care is there, and one that is properly funded, promoted and monitored? Finally, the workforce. Dentists are already overstretched and burnt out. We all know that because they all approach us regularly. Surveys show that 42% of dentists were unwilling to work under the old dental contract, and 72% say they will not sign up to the new proposed reforms as they stand. And I think that should set alarm bell ringing for everybody in this chamber. Yes, we are told the rate per patient is rising from £135 to £150, but that is actually on the price of an NHS chair per hour. That doesn't take into consideration everything else around the running of the practices, the receptionist. So I'd like to know how that figure was come up and whether the Cabinet Secretary could give some assurances about whether they think that cost will cover the whole price. So, Deputy Presiding Officer, we are moving to a new place. I think there are some good things which have been announced by the Cabinet Secretary today. You have moved, but I think there is an awful lot more work that does need to be done, and if we could have some answers to the questions that I proposed, I'd be grateful. Deputy Presiding Officer.
I'm not sure what member thinks is the more work that needs to be done. All the questions which he's asked have been answered in the contract, so let me help him with the following details. In relation to continuity of care, I made it clear in my statement that that will be a feature of the new contract and that we are providing a capitation payment to practices in order to deliver just that. In relation to the complexity of different treatments and how they are valued, the member will recall not just the proposals published today, but the ones which were published several months ago, set out the rates for different treatments, and indeed he will have seen from that that complexity is indeed reflected in the different rates for the different work. One of the things that dentists told us very, very consistently was they wanted to move away from what they described as the treadmill of a flat rate for activity, which didn't, in their view, and also in mine, reflect the complexity and the additional professional work which certain procedures, certain interventions required. So that has been remedied in the new contract, and that is at the heart of making the contract more attractive to practitioners. In relation to prevention, we already publish and track the information which the member has requested. Indeed, I'm pleased to see his perhaps newfound commitment to the transparency agenda which I've been advocating for in relation to all aspects of the NHS, including NHS waiting times. But he makes an important point about the importance of prevention. And dentists have told us for a long time that despite the changes we've brought in progressively over recent years, it has been hard to give proper value in the old contract, the current contract, to the advice and guidance which dentists can provide to patients in order to improve their oral health and to support that important preventative agenda. So the new contract does provide additional support for dentists to do that, which we would all wish to see. The digital portal which he refers to has been now up and running for several months. What that does is provide a single point of access for those who choose to use it, so that they don't have to spend their time calling up multiplicity of practices seeking an NHS appointment. They can register on the portal and then they can be told where the next NHS appointment is close to them. So that's already up and running. It's been up and running for several months. It's not the only way of getting access to an NHS appointment, but for those people who are able to be online, it does provide that extra flexibility. I don't recognise the numbers the member referred to at the end of his questions in relation to practitioners saying they will not work under the new contract. Indeed, how could they have said that? Because the details have only been published today. So that simply cannot be the case, I'm afraid. And indeed, 80% of practices are already practising under the reformed contract that already exists, which suggests to me that actually most dentists regard the progressive way in which we've improved dentistry as being better than what has gone before. But it is still absolutely the case that we have recognised throughout that more significant reforms need to be brought in to really get to grips with some of the challenges that we discuss routinely in this chamber. And I'm confident that the proposals which we will be bringing in from April next year in the form of a new contract will do just that.
Mabla Gwynfor.